channel, and a big welcome to all my new subscribers. Just wanted to kind of give you guys an update. As per my last video, I have been working. Well, let's back up a little bit. My name is Nurse Mia, LPN, and obviously, like my title says, I am an LPN. I have been an LPN for a little over a year now. But most recently, as per my last video, I have been working in a local hospital in med-surg position, a med-surg floor. Um, just wanted to kind of give you guys a little update of what I've experienced so far, all the things that I have learned. We've been doing, let's see, admissions. I've done several admissions, discharges. I've only had like one or two of those, so I still need a little bit more experience on like the paperwork and stuff that you have to give out. It's not that hard though, but I've done several admissions. I have also come off orientation. I've only been there almost 3 months, like 2.5 months. And I came off of orientation at the end of September. I was working, I was in orientation, but I was taking my own patient assignments like since the third week of me working there. And I've gradually built up from 3 patients to 6 patients. Um, I've seen a lot of different disease processes, a lot of CHF patients, a lot of COVID patients, obviously. Right now, our COVID numbers are down, and we do not have any COVID patients at our hospital, which is really good. We were getting like incentive crisis pay, extra $12 an hour for being short staffed and having COVID patients. But that has since ended as of last week. So our pay is going back to where our normal base pay is, which is fine. But back to things you do on med-surg floor. Um, like I said, you get a lot of different patients, a lot of different disease processes. There's a lot of IV fluids being hang, a lot of IV antibiotics. Um, what else? Those IV pumps, they're they'll they're still getting on my nerves. Let's just say that. They have a mind of their own. You just kind of have to play with them and kind of figure out, what to do. But I am learning a lot, and this past Saturday, actually, I experienced my first code. I haven't had one since I've been there. There have been codes, but not on any of the shifts that I have worked. Um, but this past Saturday, it wasn't my patient. We're kind of in the middle of passing meds, and it was probably like a little after 9, like between 9 and 9:30. Shift starts at 7, obviously, so it's like 2 hours, 2 hours and 15 minutes or so into the shift, and I just hear my name being yelled down the hallway. Oh, we have a code, Mia, we have a code. And at that point, you basically have to drop everything you're doing and go to wherever the code is. Um, I was besides one of the techs, I was the first person to go in the room, kind of verified what the patient's code status was. Um, they couldn't even find it. I'm not sure why. I think obviously he was a full code, but they were looking to verify that first. But the thing is, the patient was alert and oriented, was talking to his nurse, saying he wanted to watch the game or whatever, and they went in. She gave him his medicines. He said, he was fine when the nurse left out of the room. He had spit up on his shirt or something like that, and the techs were actually going in to clean him up, and they realized that he wasn't breathing. So, like I said, the nurse called. She called the code. She did over the overhead page, and then everybody. Well, most of the nurses that heard it, it was only 4 of us working that night. 2 of them didn't even hear her call the code. So obviously, like I said, I was the first person in the room, the first nurse in the room, I should say, and I had to start chest compressions. I have never done CPR on anybody before. Obviously, we only practice on the dummy at during nursing school. Um, it was kind of hard. I mean, doing the CPR wasn't hard. I did get really, really tired, and my arms were hurting a lot afterwards. But that first chest compression where you hear the patient's rib crack. Um, Kind of sets the mode. You can't stop. You have to keep going. Um, Only thing I could do when I heard the first one was kind of shake my head, like shake it off. Basically, I was just trying to shake it off and just keep going. And I did chest compressions until a few of the nurses from the ED came up to assist. They got crash cart in. One of the docs came in, and everybody start pushing IV medications. They were yelling out all kinds of orders. I need this. I need a line. I need this. I need that. I didn't know what to do. I'm just focusing on my chest compressions because I have no idea what they're talking about, honestly. But when I got tired, obviously somebody had to switch out with me. So one of the other nurses, she came in, she switched out and said, asked me if I was tired. I was like, yeah, I need to be relieved for a minute. So she took over with the chest compressions. When she got tired, somebody else kind of stepped in, and they took over. When he got tired, I stepped back in. It was kind of like a rotation. I think we did CPR for about 20-25 minutes before they called it. The whole time, like I was fighting off tears. Like I had tears in my eyes, but I couldn't cry. I just had to kind of keep going until they decided they weren't going to continue with the CPR. Um, and afterwards, I've heard a lot of stories from other nurses on different pages and like different Facebook pages, follow groups that I follow and things like that, and I see how they talk about what how they're feeling after they have their first code. I had to go back and finish passing out my medications. It gets to the point where you can take a break, kind of take a break before and gather yourself before you move on to whatever you were doing before. Um, it hadn't really hit me yet. I just knew I had to just keep going. So I went and finished passing my meds. And then I came back and we kind of reflected on the situation. And we pretty much talked about it all night. But everybody told me that I did a really, really good job, especially being my first code, my first experience with um, with that so far in a hospital setting. Um, I still kind of reflect on it a little bit. It was just 2 days ago at this point. I know there will be other codes that will happen in a hospital. So I will try to better mentally prepare myself, but there really isn't a whole lot you can do to mentally prepare yourself to basically watch someone die or try to revive them to bring them back to life. Sometimes it works, sometimes it doesn't. Unfortunately, this patient did not make it. Um, but I guess that's the world of nursing. So I just kind of wanted to give you guys like a heads up, kind of go over how to feel. I mean, I can't really tell you how to feel, to be honest, because it's just one of those situations where it's going to happen and you have to kind of regroup and accept it and continue to care for your other patients because they need you too. But like I said, that was my first code. I've been off since. I go back to work on Wednesday, I think. But yeah, this probably one of the biggest things that I've seen since I've been working on med-surg floor. I still like my job. I'm learning a lot. Um, we do have a pretty bad issue with being short-staffed, as probably any other hospital would be right now. We have had a few nurses quit within the last month and a half. Um, I don't plan on quitting because I am appreciative of the learning experience and me being still a fairly new nurse. You can just say you're a new nurse for the first couple of years after you graduated school, but um, I've learned so much in the last 2.5 months compared to where I worked before. I really do feel like you do use your nursing skills when you work in a hospital setting. I think you probably use them too when you work in a nursing home, but I feel like you got a better opportunity to learn more stuff, different things working in a hospital setting. So for any of you guys thinking, about what facility or what types of facilities you want to work in after you graduate nursing school, whether it be med-surg, neural floor, nephrology, whatever it is, ED. Um, you're going to learn a lot. And I just encourage you guys to try to make the effort um, to learn as much as you possibly can and just to continue um, learning and growing. Um, if you guys want to know like specifics, maybe I can make another video or you can give me some advice. Not really advice, but you can give me some more ideas on what med-surg nurses do. Just you can comment down below. I try to respond to all of my messages, and like I said, I am grateful for my new subscribers. I haven't been on YouTube that long, but um, I do feel like as I gain experience, I can share that experience with you guys, and the same goes for you. If you have been in this experience, and you can kind of share your experiences with me. But other than that, I just wanted to kind of let you guys know what's been going on the last 2 months or so. And I think that's it. That's all I've got for you guys. So, again, welcome to my channel. Um, and thanks for watching. Bye.